Much, moderator, and welcome. Thank you for joining us this morning. I know it's a busy time, and I especially am thankful to the representatives from the different vet schools. I know you're busy, and appreciate your time and being here. And having said that, I would just like to introduce the people that have come. I think from University of California, Davis, we have Dr. Karen Vernal. Thank you for joining us, Karen. We also have Mandy Myers, our student liaison, and thank you, Mandy, for all your hard work. Also wanted to welcome Simon Edinger. Is it Edinger, I think, or Edinger? And then Christina Junghans for joining us from Western University of the Health Sciences. We're really excited to hear from you today, and welcome. I would just probably start by saying that we'll try to follow our agenda, and I don't know how long the meeting will last. It depends, I think, on how much great dialogue we have, but we'll play it by ear. If we need a break, and after an hour and a half, we'll take one. I do want to, again, give an overview of what the VMB has done fairly recently in trying to support increasing access to care. I don't want it to sound like we're tooting our own horn, but I do think it's important to give us a context as to how far we've come and what has happened. I do greatly appreciate Dr. Miller at the end of our meeting in last week, our Veterinary Medical Board meeting, just mentioning that he felt that the CVMA felt like we had done a great deal. We hope to do more, but I think he was very complimentary at what we have accomplished so far. And I guess I would start by a few years ago, we were able to lift the California State Board for Registered Veterinary Technicians, which helped to improve access, I think, to licensure for RVTs. And that we did follow that with removing the California State Board exam for veterinarians. That actually was lifted in January of this year, 2022. I think that both of those are hopefully going to increase the number of licensees in the state, which I think will have a hopefully direct impact on access to care. We did have some information presented to us last week at our Veterinary Medical Board meeting. Compared to the same quarter last year, we have seen 18% more applications and 60% more licensees and permits from last year. So I know that's optimistic. I think it's early on. I don't know if we can actually attribute all of that to the lifting of the board exams, but I think it is an encouraging sign. So we're encouraged by that. I would also mention that our sunset bill, the Senate bill AB 1535, did two things, I think, that helped with the access to care. One, it made it easier for out-of-state licensees to become licensed in California. If you remember before that, they had to come for a 3-day course. They had to fly here or drive here and go through a fairly expensive 3-day in-person course to obtain licensure in California. And so that has been lifted, and that should help. The other thing it did was, of course, remove the board exam that we just mentioned for the veterinarians. So we were encouraged by that. The other thing that I think is helping or is in process, we have started to try to further define telemedicine, telehealth, teletriage, and teleconsultation. I think there's a lot of confusion in the profession, and a lot of things are legal to do that I think that a lot of veterinarians and owners don't realize are legal to do, and we're trying to clarify that, and we're looking for a bill right now to add that too, because it was just too complex and too late to add it to the recent sunset bill. But I think it is important that we try to clarify that and do some educational outreach about that as well. Also, we're working on the drug compounding. I think that the latest new regulations for drug compounding are very problematic to access to care, because it severely limits who can, for instance, add B vitamins and other things to a bag of IV fluids to an animal. So we're working on trying to clarify that and help to make that something that can happen in a veterinary hospital with the assistance of a veterinary assistant. So anyway, some things that we're working on. I do think the MDC has been tasked to look at the wording of vaccination clinics for the standards of care for vaccination clinics. And I think that's really important work as well as we move forward. And I might have forgotten some things, but those are the things that come to my mind. Anybody think of anything else? I know Diane just jumped on, and welcome Diane also for being here. Anything else you want to add to that list of things that we are working on right now?
No, nothing to add. Just excited that we also have this task force, right? So that in of itself is an accomplishment, just to be able to continue to discuss different ways that we can create access to care and be able to help, folks of color and all of that. So that's exciting.
Great, thank you. I do think that it's been really great I have had the opportunity to sit on the CVMA's task force for access to care, and that's been really an eye-opener for me, and it's been really exciting to see what they're doing. I will predicate this by they have not finished that basically summary. I think there's about 10 items that they want to focus on moving forward. They're going to present that to their board here at their next meeting. And then they want to bring it back to us in July, to the Veterinary Medical Board meeting in July. And I know for certain there are 3 or 4 things on that list that we'll be able to partner with them on as we move forward to try to help increase access to care. So I think I'm really looking forward to that report by the CVMA and what we can do to partner with them as we move forward. Having said that, one of the things that Michael Blackwell said, and I said this at the board meeting last week, so I keep quoting him, but probably poorly, but he really did make the point that this is not an issue that was created by our profession or by the board, and it's not an issue that we can solve by ourselves. It's an issue that I think society has to solve, and I think having conversations like this and doing what we can will help to bring this issue to the forefront in society. But I think that we also, as a veterinary medical board, can play a role in educating as best we can people about this issue. So I really think that that's important to remember, that we didn't create the problem, and nor can we solve it by ourselves. We have to work together to solve it. So I thought that was helpful, at least for me. And I don't know if I have to open it up for comment about the actual agenda items. Can I get clarification on that, or can I just keep moving? I guess that's a Jessica question.
Yeah, yeah, you could take public comment. Just a reminder, though, as a task force, you aren't bound by the Bagley-Keene rules, but I think it's always good to open up to the public for every item.
Sure, and I would love to do that now. So if anyone has anything to add to that intro, please feel free to jump in. I think we're going to move on and let the students actually do some talking too. But anybody have anything to add to the comment? And has anyone joined that I've missed introducing? I have to go look here on my list. I don't think so.
Thank you, Madam Chair. This is the moderator. I've opened up the Q&A panel of any member of the public. We have 16 attendees right now. Would like to make a comment on agenda item 3. Please type comment using the field in the lower right-hand corner of the screen and submit it to all panelists, or you may simply raise your hand. And I see we have Karen Atlas with a raised hand. So Karen, you should be able to unmute yourself. There you go, you're unmuted.
My name is Karen Atlas. I am the president of the Animal Physical Therapy Coalition, and we have made written several letters and have spoken in several public comments about the issue of the access to care problem for animal rehabilitation. And we've provided public comment, but we don't feel like we are being listened to at all. We've explained the problem to you for several years now, and the new regulations that you have promulgated has now made things worse for the animal rehabilitation access to care. So we're looking to just be able to play a role and to have you at least acknowledge the issue that animal rehabilitation access to care is an issue in California. Thank you.
Thank you, Karen. Can I ask you, have you had any further knowledge of any legislation? I think we've been trying to, discuss that might be the next step to try to figure out who can actually provide protection, as far as covering licensees.
Thank you.
Yeah.
Can you still hear me?
Yes, yes.
Yeah, awesome, great. Yes, thank you for bringing that up. And thank you for asking me a question during public comment. I really appreciate that for clarification. So yes, we have talked about this issue for almost 15 years. And we have talked about increasing access for that long to qualified physical therapists to allow veterinarians to provide direct or indirect supervision. It would be up to the vet to decide, and to allow properly qualified PTs to do that. And we have all acknowledged and that, including the vet board themselves, that the only way to fix this is through a legislative remedy. We tried to fix this in 2018, but it got derailed, and through misinformation campaigns and whatnot, there were a lot of things that were said that were not true, and we would like to get back on board with transparency, honesty, and a willingness to fix this problem. But before we can fix this problem, it needs to be acknowledged, and I'm afraid that it hasn't even been acknowledged throughout all these access to care meetings that we've spoken in.
All right, this is a moderator. I see no further requests for public comment. Shall I close the Q&A panel?
Yes, please.
Okay.
Well, I think I would like to I would like to acknowledge the students that have been working, I think, very hard on this issue. I'm very impressed with some of the polls that they have taken of their classmates and some of the initiatives that they are working on. And it's very heartwarming to see that as well. I would like to have them, I hope they feel comfortable doing this, because I would like to have them present some of the issues that they've been asking their students about and the polls that they've taken. I also would like to open the floor up to Dr. Vernal and let her explain some of the things that are happening at UC Davis regarding access to care. I'm not sure who wants to go first. It's very informal here, but Dr. Vernal, would you like to say a word, or would you like to turn the floor over to your students?
Well, it's up to you. I'm happy to go first, or I'm happy to have the students lead off. They might have classes, so I think whatever is best for them.
Okay. Well, I think I'll jump in then and ask Mandy if she wants to take the floor.
I believe Mandy might be distracted. I know she was double booked just by like 15 minutes or so.
Got it. Okay, so Christina, would you like to take the floor?
I see her camera just.
Sorry, I'm just currently in a meeting with it's Congressman Jerrigan, so I can't like switch it, but I can quickly report while Max is going. Our access to care poll got 51 responses, which was phenomenal. All students who knew what access to care was, which was 94% of our students, said that they have observed access to care issues in the state of California while they've been working in whatever clinic that they've been working at. Most of them were small animal, either emergency or general care. And there's 7% who weren't sure what access to care was, which is why I gave that as an option, just so that nobody said no because they were uninformed.
Mandy, I'm so sorry to interrupt, but just for the sake of the other participants and the panelists, can you just explain the poll that was sent out? Because I don't think that they know about the poll or the questions that were asked of the students.
Oh, I understand. Okay. So the poll that was sent out to the entire student body about whether or not students have observed access to care issues in the clinics that they've worked in the state of California specifically. So the questions that were asked were, have you observed an access to care issue? If you have, what sort of practice did you work in? Giving them the option to say shelter medicine, small animal general, small animal emergency, large animal emergency, and field service. And then I gave the option for other, and I think we had one wildlife student. And from there, they had 5 access to care issues that they were asked to rank from most common to hardly ever. And those access to care issues were, I split expenses into 2 categories, one being payment plan options for clients. So like whether or not the issue was the initial down payment that they had to take care of. And then the other expense being overall expenditures, like just not being able to afford the whole procedure regardless. And then the other questions were about distance to the clinic. The other was about the availability of the veterinarians. And then the other one was about after hours care. So whether or not they had access to an emergency after hours type clinic. And expenses were ranked number 1 by all students. Surprisingly, 67% of students actually marked the expenses being the payment plan as the most common access to care issue. And then about 54% marked overall expenses, which is to be expected. And then from there, I think it was then distance to clinics, specifically for large animal folks. That was a really big number 1 most common. And then after that was the number of veterinarians and like their personal availability for things like that. And then the last ranked one was after hours availability. And then I think Ruth is going to speak to the other access to care things if she's here.
Great. Sorry, I don't mean to put too much pressure on you. It looks like you're double tasking. So thanks for that. Would you like, I'm sorry, who did you mention was going to talk more?
I believe Ruth Goings was invited. If she's not here, I'm happy to explain the PDF that she sent my way about, the class of 2022 set together this access to care committee, and they pushed this to the curriculum advisors / organizers, and they're pushing to include access to care issues in the curriculum more heavily, especially with language barriers.
Great. And maybe Dr. Vernau knows more about that as well.
It's possible.
Okay.
I don't. I'm sorry. So I'm really happy to be here to hear what you guys have to say. So Mandy, you're a student at UC Davis?
Yes, ma'am. I was on your neuro rotation last Thursday, or 2 Thursdays ago.
Oh, just so hard with masks on, right?
I know. I get it. and now I'm all dressed up and yeah.
Okay.
I think actually Ruth did share that I think they have an access to care committee according to this document. Is that correct?
Yes. I wasn't sure if it's a committee or a task force, but it's something along those lines.
Yeah, it's signed by something that's called the Access to Care Committee, and it does. It's a proposal to increase and integrate access to care into the UC Davis Vet Med curriculum. Very well written. So I'm sure, Dr. Vernau, if you haven't seen it, you'll probably see it soon. I don't know if they've even circulated it, but it's a very well written document that discusses their ideas on how to increase access to care in their education, access to care issues.
Yeah, we'll talk about our stuff in a sec, but yeah, definitely look forward to seeing that and sharing it with the committees and the hires up.
And from your perspective, Dr. Vernal, I know that you have, what do you have currently that exposes students to some of the access to care issues that Mandy just brought up?
Yeah, I can just talk about it. I just have a one-page like Word document I could share if you would like me to do that.
Sure,
Let me see if I can do this. Looks like I don't have the ability to share. Okay.
This is the moderator. I just gave you the presenter role, so you should be able to share now.
Okay, thank you. Open system preferences. Okay, well, it looks like I can't, but that's okay. I can just tell you. So we have a little web page set up that I can, I guess I can send you. I can send you guys this little one-page document. And I don't know if Liz Montgomery is here yet. She's the other committee member who's service member who's here, but so I can share that web page. We have 4 faculty involved in the Access to Care program at UC Davis, Christian Jankowski, Jonathan Deere, Elizabeth Montgomery, and myself. And we have some mission statements there are 4. I think it will be boring if I read them to you, but our number one, our first mission statement was to provide student teaching and mentorship to develop cultural competency while cultivating clinical skills and providing high quality, compassionate care, including spectrum of care treatment options. And we have 2 others. Would you guys like me to read them or provide the document to you?
That would be great. Moderator, is there any way you can help her to share the document so she doesn't, so we can read it over her shoulder, so to speak?
Yes, I made her the presenter, so she should be able to go to share and be able to share her screen or share a document.
It's not. I don't know what's up. It might be that I'm just too used to Zoom. I'm sorry, but it won't let me.
Okay, I just tried another option. So if you could maybe try again.
Yeah, it's not letting it. Maybe my Mac computer. But anyway, I can get this to you guys to share. But number 2 is just to increase access to care for dogs, cats, and clients with limited resources. And clients, maybe standard clients as we know it, or shelter rescue clients as well. Number 3 is to provide community outreach and engagement opportunities for faculty, staff, and students. And number 4 is to collaborate to do clinical research that benefits small animal care, student learning, and professional wellness. And we have some access to care program organizations, which include the Community Surgery Service. And Liz Montgomery, I don't know if she's here yet. She's the chief of that service, where the senior students do surgeries on client-owned animals, but also shelter and rescue animals as well. So it's an educational service, but also provides access to care. Fracture program for rescue animals, Knight's Landing, One Health Center, the Orphan Kitten Project at UC Davis, and the treatment of animals burned in wildfires. And probably joining this group of organizations will be the Mercer Clinic for the homeless and the Covelo Clinic as well, and also treatment of animals burned in wildfires. So that's what we have set up so far, but it's a brand new program for us, just started in 2022.
Yeah, that all sounds really amazing. The Knight's Landing program, has that been going for a while? I think I've heard of it.
It has, I don't know how many years but it has been on the go, but yes, many years in conjunction with the UC Davis Medical Center as well.
Yeah. Is that something that students have an option to choose as an elective rotation, or how does that work?
It's I'll let Mandy answer, but it's not an elective rotation. It's something that they can, sign up to do. It's because it's just once a month, so it's not really set up as it can be an elective. But Mandy, do you want to answer?
I was just going to say, I believe that's one of the things that's being worked on, whether that's in Ruth's document or not. That's one of the things that's at least being discussed among SAVMA members. We're talking about trying to get that to be an elective rotation because it's essentially shelter medicine. It's essentially shelter medicine. So that's one of the things that we're having conversations with.
Great. Yeah, it sounds like that's a great opportunity. Nice to hear about that. I realized that I have not introduced Dr. Hanselman, and I believe we had Dr. Inglis join us in the interim from Western, so welcome. And I think you've been promoted to panelist, so we'll give you a turn to talk here in just a minute. Mandy, what do you think maybe are the next steps? I know Ruth isn't here, but do you think that using this document that the Access to Care Committee has and taking it to your faculty is the next step?
Yes, and I believe that it's already been taken to the faculty, and so now it's watching it get implemented and continuing to just facilitate that conversation to saying like, okay, maybe we can do more. I know one of the things we're talking about, at least for DEI, which includes access to care, is talking about the language barrier earlier on in prologue. So that's one of the things that is probably going to be the next step, is starting to address those issues earlier on and getting students to start to learn more languages, or at least learn veterinary Spanish for their clinical patients.
Well, it sounds like you're farther along than we are. I think we're all sort of at the beginning of this whole process of figuring out what is access to care, what are the most critical issues, which as the students mentioned, finances, that's what the research, the Coalition for Access to Care figured out in their big report too, was finances were 97% of probably access to care issues were finances, being able to afford care, but there are other issues as well. But it sounds like UC Davis is also in the process of trying to explore this whole issue and how to involve students and faculty and whatnot. So kudos to you. That sounds great. Very encouraging.
Yeah,
Thank
I think
you.
we're really excited. So students, faculty, and staff as well. So it's a big collaborative program.
Well, and I think it's important that we hear from you, because oftentimes we get in silos and we're not sure what's kind of going on, in the educational process. And yet you're really at the forefront of the next generation of practitioners. And so it's encouraging to hear that it's becoming a topic and that it's being discussed and dealt with. So that's very encouraging. Thanks for sharing that.
Yeah, thank you.
Yeah, I'm going to go ahead and ask if, and maybe I could have Dr. Hanselman and Dr. Inglis jump on. I don't think I'm sorry, I don't see you. So I think you're here. Are your videos working? Oh, there we go. I see you now. Okay. Would you care to introduce yourselves also? Or I don't know if you would like to talk a little bit about what's going on at Western.
Yeah, absolutely. Can you hear me okay?
Yes.
Awesome. I'll jump in really quickly and then I'll hand it off to Dr. Hanselman and one of our other students that's present, Simon Ettinger. I'm a clinical assistant professor at Western University, and I'm involved in some of our clinical services. And in a broad way, we've been working on trying to understand the communities that we're in and who we work with, and what their barriers to care are and how we can work to overcome those. So I had some research students a year or two ago conduct a survey of the local Pomona community that we want to integrate into more and learn about their barriers. And that will directly inform some of the changes we can make in our clinical services to meet the needs of the community right around our campus. We've also been working to understand communities in a bigger way from the perspective of those would be housed individuals we were surveying, but also working with our unhoused individuals locally. And we've set up a relationship with a local shelter, Hope for Home, that has received funding from the state of California to provide veterinary care and services. So we've been integrating with them and working as well. And then also looking from the bigger perspective, the other communities surrounding our campus that potentially need support with veterinary services through their shelters and so forth, and developing relationships clinically to help provide those. And then for our students, all throughout the 4 years of their education, they're integrating into these clinical services that we offer. So with my mobile unit, if we have clients from the local Pomona community, or we're working from unhoused individuals from Hope for Home, they're involved in the provision of that care and the discussion of the spectrum of care. And I also know we have a veterinary issues course in the first 2 years that also addresses the concept of access to care and has had Dr. Blackwell amongst other speakers with them. So I think with that, I'm going to let Dr. Hanselman jump in and go forward. Thank you so much for this opportunity.
Oh, thank you. Thank you for sharing.
Hi, everybody. I have lost my voice. So I don't know how useful I will be here. I sound like a chain smoker. I just am getting over head cold. But yeah, Dr. Inglis is actually the person who has been spearheading these efforts at Western U. I'm a assistant professor of epidemiology. I do not have a clinical appointment, so my involvement with these efforts is kind of a sideline, but it's something that I think Dr. Inglis and I both feel really strongly about. We both have our individual experiences in providing accessible or free care to various communities nationally and internationally. And so this is something that we really are trying to develop more at Western U. I think Western U is unique in that with a distributive model, we actually have students participating maybe a little bit, not necessarily more closely, but more kind of on the ground, since we don't have a teaching hospital. And so students actually get a lot of exposure to accessible or more kind of primary care throughout their curriculum, including through some of the programs Dr. Inglis just mentioned. And then through some of the more recent kind of research efforts that Simon can mention a little bit what he worked on, and some of the students that Dr. Inglis has advised, we're really trying to increase our efforts locally here in Pomona. This is a large community with a lot of need. So that's kind of where we're going. And I would actually I love hearing from the students and from the faculty at Davis. I've been in touch with Cindy, whose last name is escaping me right now, who is the Street Dog Coalition team lead at Davis. And I would actually love to see if we could set up a meeting with folks at Davis who are working on some of this to kind of see if there's any parallels that we can draw or anything that we can kind of do at the same time here in Southern California. I don't know if that was at all helpful.
I mean, I think that sounds wonderful. And I think just as Dr. Nolan, you said earlier, I think collaboration is the way to go with, well, pretty much with everything in veterinary medicine, but certainly with access to care, because I think you've got to come at it, with different perspectives and different angles. And I think working together is fantastic. I can, maybe you and I can connect our respective groups together, and we could meet sometime.
I would love that, because I think, like reinventing the wheel is something I really balk at, right? And I feel like you've already done a lot of things. We're doing our own things, and other people have done other things. Everybody has their own experiences. And so, I would love that. I can figure, I don't know if I can somehow, I don't see a chat, but I will somehow get you my email address.
We can make that happen.
Okay, perfect. Thank you.
And
I think Simon would actually be a good person to kind of talk a little bit about. Is that what you're going to say, Jamie? Sorry.
Sure, maybe Simon wants to jump in.
Sure, thank you. Well, thank you for having me here. I appreciate the opportunity to speak. I'm a second-year veterinary student at Western University of Health Sciences. And last summer, I worked on a research project with both Drs. Inglis and Hanselman. And I looked at the low-cost services that are currently offered by the college. And we wanted to do sort of an inventory of what exactly we're doing, have some numbers to look at, so that then we can look at where we need to, what we can do to expand our impact. And so we looked at the types of services that we're providing. And then we also looked at the geographic location that clients were coming from, just to know what communities specifically we were serving more or less. And so as Dr. Hanselman said, the college has these programs incorporated into the Western U curriculum. And throughout all 4 years of the curriculum, students have the opportunity to be involved in these programs. And so we looked at kind of a 3-year snapshot The programs have been going on for obviously quite a bit longer than that, but this was the period of time that we looked at. And just to give you an idea of the magnitude of the services that we're providing over that 3-year period from 2018 to 2021, these programs together provided close to 17,000 spay and neuter surgeries, administered over 10,000 vaccines, along with a lot of other preventative care services. Just to talk about Pomona a little bit, where the college is located, it's a community with significant poverty, significant homelessness, and we know that there are a lot of people who are unable to access veterinary care or have difficulty accessing it for a variety of reasons. And like Dr. Inglis said, she had students who surveyed residents in the area around campus and found that there was significant need. So we've been taking some steps to try and expand our impact locally in Pomona. So we have longstanding partnerships with organizations in surrounding communities, so some shelters in communities around Pomona and some other private nonprofits. And so those relationships have been established and are ongoing. And then additionally, Dr. Inglis has been working directly with Hope for Home, which is the homeless shelter that she mentioned. And so we have clients who are residents of the shelter who have pets, and they're receiving all of their wellness care, their spay and neuter services through some of the low-cost programs that the college offers. And then we've recently partnered with the Street Dog Coalition, like we were discussing. It's a national nonprofit that funds wellness clinics for pets of people experiencing homelessness. And we just held our first clinic in Pomona just under 2 weeks ago. And we offered physical exams, vaccinations, deworming, flea and tick prevention. It was just wellness care. And we treated over a total of 66 pets over the course of that day. And we learned a lot from the experience. It was the first time that we had done it. We had a fantastic turnout, and really felt like we learned a lot, and sort of learned what we need to talk about and work on going forward, and how we can improve the way that we provide these services. And so, yeah, it's exciting to be here and hear about things happening up at Davis. And yeah, we're just hoping that we can keep expanding our impact in our own community. And thank you for giving me the opportunity to speak.
Yeah, thanks for all that information. That was great. Did you want to share the poll that was done, or is that more something Christina would share? There was some great graphics we could have. Actually, I think we can screen share that recent poll.
Yeah, my classmate Christina is gonna speak about the poll.
Okay, good. Thank you, Simon. That was very helpful. I guess I have one question before I turn it over to Christina. How are these activities being financed? I know they mentioned that low and no cost, but how are you financing these activities? And I guess the question would be the same for Davis.
So the clinic that we just held, it was largely financed by the Street Dog Coalition. The medical supplies are all supplied by them. They have relationships with some large medical supply companies and get grant money. And then we did some local fundraising, and in addition to providing the services to the pets, we gathered hygiene items for the people and did some fundraising through the college. And then in terms of the other programs that have been ongoing, 2 of the programs are associated with shelters, with animal shelters. One is they're both city shelters, and they have the college has designated space in the shelter where they hold these clinics, and some of the animals are shelter pets that are receiving services, and some of them are community pets that are receiving services. And then we have our 2 mobile veterinary clinics. And so those are serving both a combination of rescue organizations as well as private clients. And I think Dr. Hanselman, she can speak more on the funding of those.
Great.
As you can tell, Simon is our spokesperson.
He's doing a great job.
Yeah, I know, he's so eloquent and organized, unlike me. But I think, yeah, so I think funding and fundraising is a huge issue, obviously. I mean, funding all of these different activities. And we've been lucky to have kind of this mishmash, which I'm guessing most people deal with. I also want to mention Dr. Inglis helped the Hope for Home, the local homeless shelter, write a big grant to get funding specifically so that they can provide or cover costs for their residents or for people who are part of their programs for veterinary care. So that is something that she had helped. So that is a source of revenue for that covers the residents of the shelters' pets that come to seek care from the mobile units that we have here, and also get a discounted rate at the Western U Clinic. So there's that agreement, which is kind of a separate thing. And then I think there's a huge room still for local fundraising. I think that can be, I think we did a good job. And I think the Street Dog Coalition is obviously a huge source of, they do so much fundraising and they get everything donated. I mean, it's an incredible organization, that has been built by two people, basically. And so it's really huge, but I also think there's a huge room for expansion of local fundraising that, again, would be something I would love to talk to the Davis folks about too. Obviously, we're at very different places in terms of the size of our institutions and the funding that we have. But I think just with crowdfunding, to me, is a huge place where we could go with some of this. And networking with local clinics. So that's kind of my hopes and dreams, part of my many hopes and dreams.
That's great. I think Dr. Montgomery just joined us from Davis. I wondered if the UC Davis folks wanted to jump in about how they fund some of their activities.
Yeah, I'll let Liz jump in as well. But many of these organizations in the Access to Care program have been around kind of separately. Now it's kind of going under the one umbrella. So I'll let Liz talk about funding for community surgery, and then we can chat about the other programs together. Liz?
So because we are a surgical training rotation for the students, we are mostly funded through our dean's office. So even though we're under our teaching hospital, we get special student funding for education through the dean's office. So that's how probably 95% of our program is funded. And then that allows us to provide low cost or free spay neuter to shelter groups, rescue groups, and then a lot of the organizations that through the university that are providing access to care.
Yeah, and so
can I interrupt and say, I'm really sorry, but I didn't allow you two to introduce yourselves and sort of your role, and I apologize. If you wanted to do that, that would be great for the rest of us.
Sure. Sorry, I was late to the meeting because I was on another meeting earlier. My name is Elizabeth Montgomery. I'm the current chief of service for the community surgery service, which is a senior year clinical rotation that teaches basic surgery that we think every general practitioner should be able to do when they graduate. So we mostly focus on spays and neuters, but we do a lot of low-cost, more specialized surgeries for the shelter and rescue groups, such as limb amputations, FHOs, cystotomies, enucleations, mass removals. Again, basic surgery that the general practitioner should be able to know. That's us. Every small animal student is required to do at least 2 weeks with us. Most choose to do 4, and we operate year-round.
Yeah, and I'm Karen Verneau. I'm a neurologist with the Neurology Neurosurgery Service, and I'm a member of the Access to Care program along with Liz and 2 others. So this is something that we love, and we're really happy to be part of this service and to work together.
Thank you.
And as far as funding for the other programs, they're all very different. And I can't speak from knowledge about the Knight's Landing or Mercer. As far as the fracture program goes, I think that's this is how I love it when funding comes together. So much of it is provided by the school because its main mission is to teach our surgical residents how to deal with fractures. So there's funding there, but it's also provided by, there's some industry sponsors, and a lot of it is raised. The students do quite a bit of fundraising just within our community. So it's kind of a multiple funding sources for that. And of course, if those patients, need a limb amputation or an FHO, then they have surgery over at Community Surgery. And then the Orphan Kitten Project, that's totally run by the students. So, and they're actually a 501c3 that has, programmatic niche within this group here. So a lot of their funding is provided on their own, but they also, write grants and participate in a lot of community programs. That way, because they're a club, I act as one of their faculty mentors. So those are the ones that I know about, and the other ones that will be joining, like DPON, Covelo, and Mercer, I don't know about their funding sources specifically.
We also get a lot of support from industry. We have a lot of donated products that really make a huge difference. So we're very fortunate in that regard as well.
That's great. I'm going to see if I think Christina was going to present some information. Is that right, Christina? Did I cut you off?
No, it's okay. I was actually just going to ask if you wanted me to get started earlier. So.
Yeah, that's great.
Did you want me to share my screen with those?
Yeah, if you can. I think your pie charts or your different colored charts were beautiful. I'd hate to waste that, and I think you should be able to share those.
I can't take credit for them. They're actually automatically generated from the
but it's very impressive.
Can you guys see my screen?
Yeah, we might want to make it bigger. So
I have no idea what this looks like to you guys.
Bigger still.
How's that?
A little more.
That.
There you go. I think that's pretty good.
Okay. So I would like to thank Mandy. When I started building the survey, I actually reached out, to her and asked if she would be willing to kind of share with me what she had done so that we could try to create some overlap, just to have some similar, data between the two schools, so it'll be a little more comparative. And so I changed my questions and added some based off that. We did not get as good of a response. We only had 26 responses, so about half. I tried resending it on Monday, hoping to get a few more, but I think everybody's stressed out right now with finals, and so maybe I'll try again in the fall. But out of the 26, so 65.4% definitely said yes, they feel that there is an access to care issue in the state of California. And then we had another, I think it's 23% say that they're not really sure what constitutes access to care. And then, half of those people would like to learn more. And then we did have, 11.5% out of 26, that's only 3 people, say that they don't believe that we have an access to care issue in the state of California. And as mentioned, we do get curriculum on access to care concerns through our Vet Issues course. I know that the board is familiar with that. You're one of our speakers in that course. And then also, of course, the access to care services that we provide on clinicals. I wanted to kind of get some information on just where these people's backgrounds is from, and how that might reflect on their, kind of take. So what area has been your primary clinical experience? So obviously a lot of people have done small animal GP. And then we had a couple emergency, a couple specialty, 1 food animal, 1 mainly exotics, and just various things. And then I also wanted to see what state they had obtained the majority of their clinical experience, to see if that might kind of influenced their opinion on whether or not we have an access to care issue here in the state of California. So there was overall 15 people, I don't know why these counted as separate bars, out of the 26 who have had their primary experience here in the state, and then various other states, as you can see. I did look to see, who said no, who said yes, and kind of if there was any significant, if like the 3 people who said no were from, they're another state, and it was both. So no real correlation there. Out of the 26 in your clinical experience, have you observed any specific examples of an access to care issue? So 22 people, or 84.6%, said yes. And then I did ask people just to elaborate just with comments, and there were several comments talking about distance, people who weren't able to drive from being elderly or disabled, due to cost, expense, socioeconomic disparities. So a lot of the things that, we were kind of looking for. And so then I had asked, could they rank these access to care issues by the frequency in your experience? Again, that was something that Mandy helped provide. Sorry for my notifications. And so you can kind of see here, so I had them based off Mandy's, rank most common, reoccurring, noticeable, sometimes the less common. And so the one that people ranked most common overwhelmingly was the expensive care in general, with or without payment plans. And then in terms of reoccurring, a lot of people said lack of payment plan options would be the next. And then for less common, a lot of people said distance or transportation to the clinic. And then for sometimes it was, mostly lack of emergency care after hours. And then people said that the language barrier was mostly noticeable. So kind of the order here for the way that I organized this was, it seems like a lot of people think that the main thing is just the expensive care in general, then lack of payment plan options, then language barrier, then lack of emergency care after hours, and then distance or transportation to the clinic as our general order, but obviously that does vary, and it's a small sample size. I also wanted to kind of see what their general interest was of where they hope to go after graduation, just to also kind of help answer the next questions. And so a lot of people said small animal GP, emergency, specialty, and then a few people said food animal. And then the rest, we had people say, various things like zoo medicine, exotics, and equine. I did ask, have incentives or loan repayment, salary, grant, scholarships influence your decision on your path to pursue? A lot of people said no. Some people said yes. But a lot of people who said yes also talked about salary more than anything. The people who did say yes, there are many loan forgiveness options that relate to agriculture, medicine jobs, as well as veterinary roles in underserved communities. I also asked, have access to care concerns influenced your decision on which path to pursue? If yes, please explain below. And so yes, a lot of people said that they want exotic medicine to be more accessible. So that's where they're aiming their career. Yes, they want to learn how to communicate and learn Spanish to help with farm medicine. Want to help people in circumstances where normally they wouldn't be able to access it. So it seems that it has influenced some people. And then I also asked just about location, kind of trying to indicate rural practice. Some people said, yes, it's influenced them away from rural because it would be harder to maintain a practice there. Other people say, yes, because they need care. So some different responses there, but I just wanted some, not really hard data, but just some things to kind of help me understand where the class is on their line of thoughts on this. Sorry, that was a lot of information.
Oh, that was great. Thank you very much for doing that and for sharing that. I really would like to open it up for public questions and comments if I could now, moderator. I think that I probably should have done that earlier, but.
Thank you, Madam Chair. I'll go ahead and make my co-moderator so he can share the instructions while I open up the Q&A panel. And if any member of the public would like to comment, please type comment using the field in the lower right-hand corner of your screen and submit it to all panelists. And just a reminder, if you could just please use the Q&A panel only to express a desire to make a comment. You may also simply raise your hand if you'd like to speak. And I do see we have a GV Ayers with a hand up. So GV Ayers, you should be able to unmute yourself. There you go. GV Ayers, you are unmuted.
On this occasion, I actually need to do that under public comments later. Thank you. I'm sorry.
All right, we'll go on to Heather Schrader. And Heather, you should be able to unmute yourself. So Heather, you should be receiving a prompt to unmute yourself. There you go, you're unmuted.
Can you hear me?
Yes.
Great. So I'm actually the coordinator of the Street Dog Coalition chapter here in Sacramento. I and Dr. Cindy Karsten at the UC Davis School of Veterinary Medicine have been organizing these along with a lot of other local organizations that have been a huge help, including Front Street Animal Shelter and SAC SPCA. We got started because we bring speakers in the form of usually access to care lectures to the veterinary schools. Let me back up a little bit, introduce myself. I'm an RVT who used to work at the UC Davis School of Veterinary Medicine, but currently I'm the program manager of student outreach at the Humane Society Veterinary Medical Association. And we had our chapter approach us to have a speaker, and it turned out it was the Street Dog Coalition's founder, Dr. John Geller, who speaks a lot at vet schools around the country. And they were interested in starting a Street Dog Coalition satellite. So we started one in Sacramento. We've had 2 clinics so far, and we have seen approximately at those 2 clinics, probably about 100 pets. And we've worked with the 2 local shelters, Front Street and SAC SPCA, to spay and neuter approximately 20 to 25 of those pets. I just wanted to mention there are some other barriers that, are not quite involved with veterinary medicine per se, but things we've come up against. And I know that the survey that was just showed that transportation didn't seem to be a very common barrier, but we found the opposite. And we worked really hard to get transport to the 20 or so animals that we took to the local shelters to be spayed and neutered. We had a volunteer base that was willing to go to the encampments and pick up these animals from their owners and transport them to the shelters, and then at the end of the day do the exact opposite. So that is definitely a barrier we found. It's huge in Sacramento. You know, a lot of the unhoused individuals live in these huge encampments, and they don't have access to public transportation because they won't allow them to take their pets either on the light rail, on buses, via Uber, Lyft. Cost is definitely an issue, of course. And then another thing is housing. Anybody that lives in the Sacramento area or even in California knows that access to housing that allows pets is a huge issue. I mean, housing itself is an issue for the unhoused population, but housing that will include pets without an exorbitant fee is almost non-existent here. And so that's something else that we definitely are working towards trying to address through HSVMA and our parent organization, looking at legislation that will help pass, bills that allow people to gain housing, because we find that they do want housing. They just can't find adequate housing for them and their pets. And a lot of these people would rather stay in an encampment with their pets than, go to a shelter. Thank you.
All right, this is the moderator. I see no further requests for comment. Shall I close the Q&A panel?
Yes, thank you. I think Diane has her hand up.
Yeah, thank you so much. And, and thank you so much for coming to speak to everyone. And I appreciate what also I've, learned about what the veterinary community is doing in terms of access to care to the consumers. I had a question in regards to in whether there has been discussion amongst you and the students, and then also those in the veterinary student community in regards to the lack of diversity within the student population and within veterinaries in general. As we know, there is a huge lack of diversity of veterinarians, of Black, Indigenous, and people of color. And so what, if any, demographics have been done in terms of, the demographics of the actual students entering vet schools? And has there been any discussion of, what could possibly be done to then diversify the veterinary community, and starting with the students? and accessing community? I know that finances is a barrier, but has there been any more discussion on how to actually diversify the veterinary students so that there is a diversification of veterinarians, so that those people and so folks in the community have veterinarians that they can relate to?
I'm sorry, this is Rhea. Can I address that? I'm sorry.
Sure.
Yeah, no, anyone, please. No, this is a free for all. I'm so happy that you are all here so we can ask these questions. No, yeah, thank you.
If you can hear my croaking. So I just wanted to say, again, I'm newer faculty. Dr. Inglis and I have only been here since 2018. But not to put Dr. Barr on the spot, but I see that Dr. Barr, who's our Associate Dean for Academic Affairs, has also joined the conversation. And Dr. Peralta, who's a specialist in animal welfare. So anyway, just two more representations who may be able to speak to some of this. I know that for a fact, one of our current faculty members actually did her PhD on diversifying our student body. We have a very diverse student body at Western U. We're also representing a very diverse community down here in Southern California, right? So I don't know, Dr. Barr, if you, I don't know, can she be made?
Yes, panelist, would you mind letting Dr. Peggy Barr become a panelist? And then you mentioned, I think someone else, and I missed it.
Dr. Peralta, I think I saw his handle was
Peralta.
J. Peralta.
Thank you. This is the moderator. I'm looking in our attendee list. You said it's Peggy
Barr.
Peggy Barr. And I'm not seeing a Peggy Barr.
Oh, sorry. She was there a second ago. Maybe she had to
She was there a second ago. I just saw her. And
she's a very busy person.
Okay.
I was going to ask while we work on that if I can make a comment. Just in response to the public comment, I should have prefaced my survey with this is 100% student perspective and is probably not reflective of the actual true statistics on access to care concerns. But I really appreciated the comments and information. And then also to kind of address the new topic of conversation. So Western University of Health Sciences has a program called HCL, Health Career Ladder. And this program intentionally reaches out to underserved communities in Pomona, to students who may not have opportunities to explore health careers outside of this program. And so what we do is monthly on a Saturday, we host students from elementary, middle school, and high school to come and learn about the different health careers. And I've actually been running the vet med track for that program for the past year. And then in addition to that, Western University is also, I'm helping plan the veterinary summer enrichment program this summer, which will be reaching out to underrepresented minorities in veterinary medicine and trying to give those kids an opportunity to have that learning experience that they wouldn't otherwise have. So we're offering partial and full scholarships to those students based on financial need, and also offering scholarships to the HCL students that are a part of that program. But it's a wonderful program, and so I always want to mention it and bring that up as something that is encouraging these students from diverse communities to pursue health careers, including veterinary medicine.
Great, thank you. I would also add, and I know Jessica knows more about this than I do, but I think the state is starting to gather quite a bit of statistics, right, Jessica, about the demographics of, I think, of physicians and of veterinarians and different licensees through the DCA. Is that correct, Jessica?
Yeah, there was recent legislation that was passed that became effective this year. And so there's a department who will be collecting a whole bunch of data, workforce data as it relates to all healing arts professions. And so how that looks is when a veterinarian goes to renew their license, they're going to be taken to their department's website to do an optional survey. They can opt out of the survey, but we definitely encourage everybody to complete that survey and give us more accurate workforce data so we can help identify really where the gaps are and where all the veterinarians are located.
Great, thank you. I think Mandy has her hand up too, or is that an old hand?
It's a new hand. I just wanted to speak to the few things that I know UC Davis is doing, and Dr. Renaud, please, if I miss something, jump in. I know that we do the summer enrichment program where students are assigned to a mentor who's at UC Davis, because the idea is to get more people from more diverse backgrounds to apply. I don't get to see the application demographics. I don't know that anyone in the student body does, but I know that I can see our classes demographics, and there are underrepresented populations. So I think that's something that we could definitely continue the discussion of, is how to continue to outreach and receive more applications. But again, I don't know what the demographics look like for in terms of the actual application.
Right. I think, let's see, Dr. Hanselman has her hand up, and then also Brittany in the public. So we'll go to Dr. Hanselman first. I think you're still muted.
Wrong button, sorry. I tend to talk a lot, so I don't mean to hog the conversation here, but I just was thinking of another thing since we're talking about access to care in general. Western U also recently started a program, a joint residency program with the San Diego Humane Society, which is a huge humane society, has huge county, really large reach. And one of the residents there is working with Dr. Inglis and I to identify and define what constitutes a veterinary desert. There are some other people that are actually working on similar projects, but that also again is this idea of identifying which communities are actually in need, right? And where and what are those barriers. So it's another way to kind of access more vulnerable or more underrepresented communities, both in terms of healthcare access or veterinary care access in this case, and potentially outreach.
Is that something that, I mean, it sounds like that is an ongoing research project. Is that correct?
Yeah, so Dr. Dr. Laura Bunke is a first-year resident, just finishing up her first year at San Diego Humane Society, and that is her residency project. So she's just starting that. She's also partnering with Sue Neal, who has this beautiful data-driven website that identifies what she calls the VCAS score, so the Veterinary Care Access Score, which is actually a beautiful website that I try to share with a group that has used parameters to identify counties and kind of scores each county by veterinary access. So it's another resource that I was previously not familiar with Dr. Bunke alerted us to. So yes, it's an ongoing research project, which will probably extend past Dr. Bunke's residency, just because there's so much to do.
That's exciting news. I'd like to keep track of that for sure.
Yeah.
I think Dr. Vernau has her hand up, and then if we can go out to public comment after that.
Yeah, I just wanted to respond to your question about diversity at UC Davis and invite Liz to help me out here, because I know that it's a huge thing at Davis. It's been ongoing for years, and there's a lot of programs like the one that Mandy mentioned, including high school programs, but diversity is a big thing with our students, staff, and faculty as well. So I'm not involved in that part of things from the school, so I can't really give you a really good idea of the scope of what's happening, but it's pretty big. And Liz, maybe you can a little bit more. And she may not be here, but anyway, we're probably not the best people to report on that, aside to let you know that there's a lot happening and a lot of people working really hard in the area of diversity. So I think I'd have to defer to others to give you an accurate representation of what UC Davis is doing.
No, that's
Yeah,
great.
I agree.
Oh, sorry.
I don't have numbers. I will say that I was a part of the interview committee this year in December, and it was a very diverse population. I was actually really impressed with the amount of diversity on the interviews that we did. So that made me pretty happy. But I don't have true numbers for you. Unfortunately, just Carl Jandry is the one that you would want to reach out to. But I don't have numbers I can quickly access.
Okay, great. And I think we'll reach out and we'll get the name of and email of that person because I think it's in terms of not only veterinary schools providing access to care, and that's great that there's a curriculum about access to care, but then also truly how do we get more vet students that are Black, Indigenous, people of color, right? In order to be able to help the communities that there are the veterinary deserts in. So it'd be great to take that information, and I'm like, that'll be on the agenda for then the next task force meeting to really dig into that. And then just to, and maybe perhaps those are those folks that you mentioned are the best to be able to answer this question. But just in terms of loan forgiveness, I know that there's loan forgiveness for rural areas, but do any of you, and maybe even the students, like maybe the students know better, they're like, we know about loan forgiveness that there is or isn't available. And yeah, loan forgiveness.
Yeah,
Before they
I
answer
don't know.
that
Sorry, there's
question,
other.
though, Yeah, but I feel bad because I think Brittany's been having her hand up for a long time. So,
Okay.
moderator, can we go out and see if Brittany has a comment on this current question?
Thank you. So, Brittany, you should be seeing a prompt to unmute yourself. So go ahead and click it. There you go. You're unmuted. And Brittany, if you are talking, we are not hearing you. You are unmuted. Oh, let's try that again. So Brittany, there you go. You're unmuted.
Are you able to hear me now?
Yes.
Oh, wonderful. I'm so sorry about that. Commenting question I have is with regard to the present.
This is moderator Brittany. We could hear you, and then your voice got really soft. So if you could get close to your mic or all right.
All right, one more time with feeling.
Okay, we can hear you, but your voice is very soft. So just maybe speak louder.
All right. I can put this in the chat as well, if that would be easier. My commenting question is actually separate from the current discussion, and so I'm happy to pass the floor back to Ms. Prado and her question.
Okay, that sounds great. We'll circle back to you, Brittany, and I'll turn the floor back over. I think that Diane had another kind of avenue you wanted to go down, right, Diana?
Yeah, well, I'm like, while I have you students here and the folks from the veterinary schools here, I just wanted to ask a question in regards to loan forgiveness and how that, what loan forgiveness is currently available. And I guess that's, I'll start with there. What loan forgiveness is currently available? I see Mandy has raised her hand. Thank you, Mandy. Unless it was a hand from before.
No, it's a new hand. The only loan forgiveness program that I am particularly aware of, and that does not mean they don't exist, is there's some program for students who go out and work in shelter medicine. I don't know the exact year amount that they have to do that, but that's the one I'm familiar with, is that students graduate, go and work in shelter medicine, and then for X many years, and then they get loan forgiveness for that. On a separate note, I know that Kansas has rules around loan forgiveness where if you work for a 501c3, I think that's the right thing, a nonprofit organization for, I believe it's 4 years, that they get a similar loan forgiveness thing. So I don't know if California has 501c3 legislature necessarily, but I know that at least at Davis, we're taught about the one working for Shelter Med. And I can reach out to Dr. Jim Clark about that.
Looks like Dr. Hanselman has her hand up.
I saw that Liz did too. This is definitely not my area, but I do just want to second what Mandy was saying. I know that there's a program that historically was 10 years in academia or public service, that then forgives your student loans. I am not part of that program. That's why I don't know the details, but I know that we have faculty that are part of that program currently, and I have colleagues who have had their loans forgiven. So there are those kinds of programs. which may have also been accelerated, I think, through the new administration. But I'm not privy to the details. Again, Liz may have more information.
Yeah, no, it's 10 years of service in a public service organization. Historically, it has been very hard to get the paperwork submitted and approved. So it's been very difficult for a lot of people to actually have their loans forgiven after 10 years of public service. It also depends on the type of loans you have, unfortunately. I think I agree with the new administration. I think it has become a little bit easier to get these types of loan forgiveness programs approved. But historically, it's been pretty difficult to truly jump through all the hoops and get all the boxes checked and get your loans forgiven. But it is 10 years of service in a public service organization, such as a nonprofit or an academic institution.
Great, thank you. Moderator, I think Heather has her hand up out as a public member.
Thank you, Madam Chair. And Heather, you should see a prompt to unmute yourself. There you go, you're unmuted.
Thank you. Yeah, Liz pretty much said what I was going to say about public service loan forgiveness. I actually had my loans forgiven last year, and it was a long and arduous process, although it has been changing. And of course, the loan repayments have been on moratorium since the start of the pandemic. So I think when everything's said and done, who knows whose loans will be forgiven after that. But it is a 10-year program, 120 payments. And like Liz said, it's anyone who works for a nonprofit or government institution. Also, if you work on tribal lands, that also qualifies you. But it is in this weird landscape right now. So who knows what it's going to become. I just know that anyone who hasn't made payments during the moratorium, those months still count towards public service loan forgiveness. So even if you haven't been paying, you've had 2 years of basically free payments counting towards your loan forgiveness. So we'll see how that goes in the future.
Thank you. I appreciate that. I know the same for attorneys, right? In the public loan forgiveness, and it's tough to actually do the paperwork. So congratulations on getting that done. I have a friend of mine that finished that too. And so I saw that Christina had her hand raised too as I just jumped in.
And so did Alana out in the public. So we'll think Alana's was first and then Christina's. So moderator, if you could let Alana.
Yes. So Alana, you should see a prompt to unmute yourself. There you go, you're unmuted. And Alana, there you go.
Hi, good morning. Can you hear me?
Yes.
Hi, my name is Alana Yanez, former board member of the Veterinary Medical Board, and I'm the current Director of Operations for Companions and Animals for Reform and Equity. Companions and Animals for Reform and Equity is a national nonprofit organization committed to identifying and reducing barriers for BIPOC communities and leaders in animal welfare. And I'm very proud to be representing this organization this morning. We just want to point out a couple of things. This whole problem really is compounded by already challenging problem of veterinary shortages in underserved areas. Black veterinary graduates have significantly more debt than white graduates, and Black professionals across all industries earn substantially less across all industries than white professionals. And so despite being a recognized leader in state level policy in so many other areas, California ranks among the lowest ranked states for access to veterinary care. States with better veterinary access scores tend to also have student loan relief programs. As such, we urge the Access to Veterinary Care Task Force to make every effort within its authority to support student loan relief measures in the state of California. Specifically, we urge the task force and the veterinary schools to develop proposals that facilitate statewide veterinary loan forgiveness and relief for veterinary graduates, develop methods of educating current veterinary students about loan forgiveness and income-based repayment options, including public service loan forgiveness programs and the temporary extended public service loan forgiveness program. Identify and make recommendations for utilizing federal, state, and local tax and financial incentives that would encourage the development of veterinary practices in veterinary resource deserts, and develop proposals to reduce or eliminate regulatory barriers including but not limited to restrictive permitting requirements that might restrict employment opportunities that would otherwise qualify for loan relief or forgiveness. In a nutshell, we need to cut down the red tape. We need to make loan forgiveness easier for folks who are opening up their veterinary practices in low-income, underserved communities. And as we all know, majority of these low-income, underserved communities are communities of color. And I would also like to point out that there's actually, I think it's the AVMA has facts pointed out that a lot of veterinary students tend to go back and practice in communities they're familiar with. So if we can create a pipeline of prepared BIPOC veterinary students who will then in turn go back and practice in their underserved communities, we all would be in a much better place. Thank you so much for your time.
Thank you, Alana. And if you don't mind sending all that to me or to Jessica, that would be helpful. The verbiage. I didn't take as good of notes as I could have. I think, I'm not sure if we cut off Christina either. Christina, did you have something to add?
I was just going to mention other potential loan forgiveness opportunities that I've heard about in the past. Also from USDA and some of those, practicing in rural area, grants and opportunities for at least partial repayment. And then partial repayment opportunities for also enlisting in the armed forces. But I think everything else I'm aware of has already been discussed.
Great, thank you. All this has been really, really helpful and educational. I appreciate it. I'm going to go ahead and move on to number 6 on the agenda, which is actually fairly brief because it is talking about the potential ability of the Veterinary Medical Board to do some educational outreach regarding incremental care. I know that probably the spectrum of care might be the newest term to be used. I don't know in veterinary medicine if you have a preference, but I just wanted to bring up that in the JAVMA October 2021 issue, there was a good article about spectrum of care. And I know that the Veterinary Medical Board has had some discussions about this. I would like to just fairly quickly read a paragraph out of that article that I think might be pertinent to us. It is, I'm quoting from this article in the JAVMA, it's volume 259. It is possible that some veterinarians default to offering the most intensive and most technologically advanced treatments because of liability concerns or concerns about losing their license to practice if they were to offer other options that they perceive as not meeting the so-called standard of care. Most state veterinary practice acts require that veterinarians practice in compliance with a standard of care. However, quote, standard of care, unquote, is a legal term defined as care required of and practiced by the average, reasonably prudent, competent veterinarian in the community. This definition is vague and can vary over time and across geographic locations. However, it does not require that general practitioners provide the same level of care as specialists or dictate that the most intensive and most technologically advanced care is the only acceptable care. Complaints filed with state veterinary boards can result in fines or suspension and revocation of a veterinary license. However, good client veterinarian communication can help avoid most of the misunderstandings that lead to veterinary board complaints, and good medical record keeping that documents discussions with owners and clarifies that owners were fully informed before deciding on a care option can be the best defense against them. So I, after reading this article and looking at that paragraph, thought that, and have talked to Jessica about this, that it would be really helpful if we did try to provide some information, educational information on our website or in our newsletter that really talks about spectrum of care. And I thought it would be really helpful if the representatives from the 2 veterinary schools in California could speak to that. Do you see this as being a burden on access to care? Do you think that the profession, and do you see your students being concerned about this? And do you have any ideas of what would be helpful from the veterinary medical board standpoint, is there something we could do to clarify that? I think you're probably all aware that legislation, regulations, and statutes are something that we can't, that have to be vague for many reasons. I mean, they can't be specific because things change and standards of care change, et cetera. But how can we help to clarify what a good record would look like that would help to modify or reduce any anxiety on a veterinarian's part, that they could provide incremental or spectrum of care? Does that make sense? Anyway. Any comments on that?
I was going to give Mandy a second to see if she wanted to speak first. I would agree that it's a little nerve-wracking to understand. My personal background is I'm actually from the state of Alabama. And there's something about, you know, kind of having access to a rural area and seeing the difference in what people would call standard of care, especially varying from, you know, older veterinarians to younger veterinarians. And especially in the training purposes, that makes you wonder a little bit of what is it today, and where do I need to be? I would say that our vet issues course, you know, we do talk about medical record keeping, and we do cover, you know, California law in regards to what that entails. I would say that I feel at least slightly more prepared from that course. I don't know if I'll ever feel fully prepared, you know, until I'm out and doing it and being held responsible under my own license. In regards to what the veterinary medical board can do, I don't know what you have already done. So I feel like I have like a poor perspective on this of, I don't know what has been done to already help in this regard. I don't know if there are CE or training opportunities on medical record keeping. So there's a little bit of ignorance there that might affect my opinion. I know Mandy's here, but one of my classmates, Simon, is also here. If he has a comment on this, I would like to give him the opportunity to speak on it.
I can just make a brief comment, and it kind of goes along with what Christina's saying, that I don't think we have too much exposure to it. When Dr. Michael Blackwell came and spoke to our class, he talked about this as a concept, and it was the first time I had heard it spoken about sort of in a formal sense. And I think it could be valuable for us to, you know, as students, get more formal education on it, and, you know, a better understanding of how we can sort of put it into practice, because I don't, and I'm only 2 years through the program, so who knows, you know, what more opportunity I'll have to learn about it, but I think it could absolutely be something valuable for us to learn about as students.
Thank you. Mandy, are you there? Would you like to say something?
I am. Unfortunately, this is something that I've had very little exposure to. And so I don't want to speak out of turn, but I'm sure that UC Davis has educational outreach and regarding incremental care. I just am not particularly familiar with it. I can do some research on it and bring it to the next task force meeting though.
Any of you clinicians or instructors from Davis have any comments on this? I know it's sort of feel like it's sometimes the white elephant in the room, because you know, the Veterinary Medical Board is tasked with protecting consumers and their pets, and I think, and their animals, and I think that there's always been that sort of angst about if what am I doing in a clinical setting? Is it reasonable? Is it what's the definition of reasonable? Have I documented options that I've given my client? There, you know, that I understand that's sort of a hard topic to talk about, but I feel like if we don't talk about it, or at least have a conversation, especially with our students, you know, we're probably making the problem worse. I don't know. I guess Liz has her hand up, so I'll be quiet.
So I can speak a little bit to our service, and some of the things that Davis is doing is, really expanding the community programs that we have that the students rotate through so that they are truly getting community education versus just the specialty education. On my service, because we do have to pay very particular attention to costs as we are a nonprofit service on the rotation within the teaching hospital, we talk to the students a lot about spectrum of care. So let's say we have a shelter animal come in with heartworm disease that, there is not money for amenicide. This shelter animal still needs a surgery. How can we make this the safest procedure for the animal with limited resources? Or a shelter cat comes in with a heart murmur. It still, again, needs to have this surgery. There's not money for an echocardiogram or any of the other things that you may typically offer. How can we get around this, and what can we do to, again, still provide the safest medical care within confines of spectrum of care? So it's something we talk about a lot, and then truly just documenting it in the medical record that it was either offered to the client or discussed, and how we proceeded without that additional diagnostic capabilities.
Great, thank you. Looks like Dr. Hanselman.
Yeah, and I should, I'm learning so much from this conversation. I just want to say, so again, I think in the 17 years I've been a veterinarian, I went from, specialty practices, emergency care, where we have all the bells and whistles, to very basic, like what I practice now is literally preventative care, vaccines, and occasional blood draws. So I think, but I think it just, in those years, what I've learned is one of the things that Dr. Nolan said, and I'm just going to echo what Liz is saying too. I think communication is key, right? And just that, I know, is an emphasis in our curriculum, and I know, probably in every veterinary school curriculum more than it was back when many of us were in school. But communicating all of the options and never assuming, I think, is something that I have learned, right? Just being, providing an opportunity for the client ultimately to make the decision as to how they would like to proceed. And then also, I think this is also a reason to really hone our history taking and physical exam skills, because that to me is such a huge, and I think everybody would agree, that is our primary diagnostic and is such a powerful tool. So I think understanding that and really honing that, I think, is, just a really important thing to focus on. So I don't know if it's probably tangential, not really useful, but yeah, anyway, I think it's, offer everything and then do what is possible.
Great, thank you. Looks like Dr. Vernal has her hand up.
Oh, thank you. I just want to echo what Dr. Hanselman and Montgomery said. I'm a neurologist, neurosurgeon at UC Davis, so I think I function at an academic institution doing neurology and neurosurgery. So we do try and emphasize to the students exactly what you said, Dr. Hanselman. We try and start with history, physical exam, the neuro exam, differentials, and options for every particular client. Not everybody wants to do a craniotomy, to remove their cat's meningioma, but, many people do. But just trying to get to that point with the students, and of course, documenting all different options, not, teaching them that you can't judge people on what they're going to choose. So you need to offer that to everybody. And that includes our rescue and shelter clients, our clients from Mercer and Knights Landing as well. So it's definitely a collaborative message, but we do highlight, and emphasize the physical exam and the neuro exam and localization and differentials, and trying to get through options and communicating that to the client and trying to come up with the most reasonable option for them and their pet.
Great, thank you. And Diane has her hand up.
Yes, thank you for that. No, and I think it's so important to discuss incremental care as we are discussing access to care, and as everyone has pointed out, the communication piece, right, and how we're communicating that to the client. I'm like, which then circles me back around to the diversification of veterinarian students and being able to get a population of students that then is able to, so the community is reflected within the veterinarian that is able to help them. And that's important. And so I'm kind of circling back to the veterinary summer internship program and the healthcare ladder from before. If it's possible to get demographic data from that, that would be amazing and great. And if also, I'm like, my last pitch to the students, again, I know it's like I'm going back to agenda item 5, but not really. It's all part and parcel together. If there are any students of Black, Indigenous, or people of color, veterinary students that would be willing to speak at the next meeting, that would be great. I just was at the amazing Animal Care Expo in HSUS, and Dr. Leela Miller spoke about her experience, who's been dubbed the mother of shelter medicine, who spoke of her experience at Cornell University. And so it'd be also great to hear from students that are BIPOC about their experiences, what they think that could happen in order to access more, open it up the diversity for those students. It'd be great to do that. So, anyone want to email us at, Jamie and I or Jessica, that'd be great, or we can reach out after this.
And thank you, Diane. Dr. Vernal has her hand up again.
Yeah, I just want to say there's a lot of people working on that at UC Davis. So maybe Jamie touching base with Dr. Stern or Dr. Stetter. I think it's a really important issue, and I definitely am not working in that area. Doesn't mean I'm not working hard, but there are other people who can better discuss that and give you a better idea of what's happening at UC Davis, students, staff, and faculty. Again, lots of great programs that I'm not going to be able to demonstrate to you. So it might be to get the right people at the next meeting.
Good, and I'm going to use that as a stepping stone to apologize for me. I've moved this meeting. We have moved this meeting several times, and they were intending to come. I know Dr. Stetter was trying to, but we just had some technical difficulties of the WebEx and timing and whatnot. So I appreciate that, and I think those are great, great comments. And I'm going to go to Liz, I think.
Sorry, muted. Diane, I don't know if this helps you at all, but I'm just quickly looking at the 7 students that are currently on my rotation with us. So this is representative of the class that's graduating in a month. And of the 7 students, 4 are represented by BIPOC.
Thank you so much for that. That was very quick.
And is that
it's a small snapshot, but something.
And if you look back on rotations throughout this last year, is that fairly representative, do you think, or?
I do.
Okay, great, that's helpful. And Rhea, I think your hand's up.
Yeah, I was just gonna kind of speak to the Western U side of in terms of contacts. I think Dr. Susie Kovacs, who's also one of the course leaders for the veterinary issues course that discusses many of these policy issues that we're talking about. She's also the recently elected AAVMC Diversity, Equity, Inclusion Committee Chair. And so she would be a good one. She's also the person who did her PhD on increasing diversity in our student body. So she would be a great person to talk to about, about some of your questions and getting data. She's also an epidemiologist.
Awesome. Thank you so much. Thank you.
Great. I think I've got a hand from Christina.
I apologize. I was just going to quickly say I'm happy to facilitate that. I think I have connections to the HDL and the Veterinary Summer Enrichment Program. And then I know some students that I have in mind who I think would be willing to come speak with you guys. And then I'll also reach out to Dr. Kovacs. I just wanted to say that I'll work on that for the next task force meeting.
Great. That's great. I'm going to ask the moderator to open it up. I think we have a hand raised. And actually I would like her to open it up for any comments on incremental care and also public comment on items not on the agenda.
All right, thank you, Madam Chair. I've opened up the Q&A panel. If any member of the public would like to make a comment, simply type comment using the field in the lower right-hand corner of the screen and submit it to all panelists. Or you may simply raise your hand, and I do see we have Heather Schrader with her hand up. So Heather, you should be able to unmute yourself. There
Thank
you go.
you. Thanks. HSVMA has a veterinary student scholarship or several scholarships that we offer every year. And historically, our recipients have been BIPOC students. So my question to Diane was, are you looking specifically for California resident students? Because I can definitely refer you to some of our past recipients. They're happy to talk about their experience within veterinary school as a BIPOC student, but I wasn't sure if you were looking specifically for California residents.
Yes, California is what we're looking for.
Okay, great. Thanks.
Thank you so much.
All right, and next we have GV Ayers. So GV Ayers, you should be able to unmute yourself.
Thank you. This is G.V. Ayers. I represent the Animal Physical Therapy Coalition. This is, I believe the chair said under public comment under items not on the agenda. Is that correct?
Yes, absolutely.
Okay, great. Thank you. Thank you so much. I'm G.V. Ayers, and as I said, I represent the Animal Physical Therapy Coalition. We are concerned with the access to physical rehabilitation services for animals and the ability for people to access the care provided by licensed physical therapists qualified in animal physical rehabilitation for the essential care for their pets. We are concerned with access to animal physical therapy and urge the task force and the board to acknowledge the issue, the current issue. And we appreciate you hearing from the coalition's president, Karen Atlas, earlier under the overview of accomplishments agenda item. And thank you, Ms. Prado, for the question to Ms. Atlas. Of course, we believe that legislation is essential to provide a bridge for qualified licensed physical therapists to perform these services upon veterinary referral and under the level of supervision deemed necessary by the referring vet. And we are having, and specific answer to your question about legislation, we're having active discussions with the legislature, and we anticipate legislation being introduced in the upcoming legislative session. And we just want to highlight this issue and would appreciate acknowledgement on a perhaps more formal basis by the board and by the task force of the issue. Thank you so much for your time.
And next we have comment from Karen Atlas. Karen, you should be able to unmute yourself. There you go.
To speak again at this meeting. My name is Karen Atlas. I am the president of the Animal Physical Therapy Coalition, and we are a coalition that represents veterinarians, physical therapists, RVTs, and consumers. So we are a multiple stakeholders group that are like-minded in our quest to increased access to animal rehabilitation. We have brought this up in meetings and in letter form and in public comment times through the October 12th meeting in 2021, and January 19th meeting and the April 20th meeting, and several other times as well. Unfortunately, we have yet to have our concerns merely even recognized during any of these recent meetings to identify that the access to rehab care even exists for this. What was notable, however, was the attention the California Veterinary Medical Association was given to the areas of access they identified as being a problem. But the CVMA is not the only voice for DVMs and RVTs anymore, and neither are just the two vet schools either. Rather, our coalition also represents DVMs and RVT voices, as well as consumers and PTs, who not only wish to be heard by this task force, but expect to be treated with the same respect and recognition that is granted to the other organizations. Unfortunately, the board enacted regulatory language which further reduced access to care for animals for rehab by making it more difficult for qualified physical therapists to provide essential animal rehab services in California. So the APTA asks that this task force to consider these measures of legislation as a vital part of solution to address this area of problem in California. Notably, during the January 19th, 2022 CVMB meeting, the board specifically asked this task force to identify all access to care issues. Our coalition has specifically identified this access to rehab care crisis for years without resolution. We have taken the time to research the specific issue and find a solution, but time and time again, the board refuses to even recognize it for the problem it truly is. And it is a problem that will not go away by itself. The consumers have been asking for this, and it appears that the board and the task force are ignoring the very stakeholders who are tasked to serve. So, as you have been noting in the recent meetings, many areas of the access to care issue are going to be very difficult to solve because of the socioeconomic nature of these. This board has very little authority to be able to make meaningful change for those larger areas, but this issue is different. It has a straightforward solution through legislation. I was encouraged that you referenced the VMB Sunset Extension Bill at the top of this meeting. If you have a chance to listen to the VMB Sunset Review, the legislature had also identified animal rehab as an issue that needs to be dealt with. General Roth, the chair of the Senate Business Professions and Economic Development Committee, questioned President Nunez about this issue specifically. There you can get confirmation that the board has indeed been aware of and understands that legislation is necessary and that the board does in fact want authority of PTs to be added to the Vet Practice Act. There was over an hour of public testimony provided by vets, RVTs, consumers, and PTs at the Sunset Review hearing. So if you go back and listen to it, you will hear what the people of California want. So I will ask again here, will this task force recognize and acknowledge the ongoing access to animal physical therapy in California? Thank you so much.
Thank you, and I appreciate Mr. Ayers and Ms. Atlas's comments. I do know we've spent a lot of time going over this, and I think we are very interested in continuing to be in active discussions regarding legislation, because I think there are enough problems that I think legislation is going to be the right way to go. I better be careful. I'm probably going to get out of turn, but that's my honest feeling, is that we do want to work together. We do have options, I think, through legislation that will fix some of the problems from our standpoint with consumer protection. So thank you for coming and for sharing your concerns and your thoughts. And thank you all. I feel really, really encouraged with this discussion. And I appreciate all the time everyone has taken. I think it's probably time to move on to the what's next. And I do, I think that I really do think that the next Veterinary Medical Board meeting, July, will have access to care discussion in the agenda, and I think that's going to be very helpful. I do want to open it up. I think the next step is to actually hear what happens with the July meeting and move forward from there. But I'm open to ideas on future agenda items from the people that are present here, and I'm looking forward to hearing your ideas. I do not see anyone on the panel, so moderator, if you could open it up to the public, that would be great.
Thank you, Madam Chair. I've opened up the Q&A panel. If any member of the public would like to comment, please type comment using the field in the lower right-hand corner of the screen and submit it to all panelists, or you may simply raise your hand. And I see Lana Yanez has raised her hand, so you should be able to unmute yourself. There you go.
Hi, can you hear me?
Yes.
Perfect. So one thing I think would be great for the future agenda items is I am a graduate of UC Santa Cruz, and when I was in high school as a Latina second generation college student, I was eligible for these programs that UC Berkeley used to put on called Early Academic Outreach Program, EAOP. And I'm a huge proponent of not reinventing the wheel. UC Berkeley ran these programs. They ran them extremely well. I started doing these programs when I was a junior and senior in high school. It was a Saturday class, and we would focus on getting into college. We took science classes, we took math classes, we took English classes to strengthen our skill set to take the SATs and the ACTs, which I know is no longer almost completely relevant anymore. A lot of schools have gotten rid of that as a requirement, but it was all college preparatory classes. And I think this is something that UC Davis could learn a lot from. And I think it's something that Western could also learn a lot from. And it might even benefit the Veterinary Medical Board to have the EAOP representatives come and discuss their program and talk about their demographics and talk about how they are creating a pipeline of prepared BIPOC students just to get into the university system. So that would be my suggestion, is bringing in the people who have done this for a long time. I was going to these programs in 1996 and 1997, and I believe it's still in action. I believe this program was around when my mother was in college. So I really would encourage the board to look for people who are doing this work and doing it well.
All right, our next request for comment is from Brittany Benizzi. So Brittany, you should be able to unmute yourself. And Brittany, you are unmuted.
Are you able to hear me?
Yes, you're just soft, so you might try to speak as loud as you can.
Okay, thank you so much. I have dropped one of my questions into the chat regarding the survey. I'm wondering if there is an opportunity based on today's discussion for a follow-up survey, potentially resurveying present survey respondents regarding potential solutions or pieces of the puzzle to solutions with access to care issues that they've seen. I think it would be very interesting to hear from our next generation of veterinarians what types of options they see as most applicable in California, and wondered if that might be something that we could expect at a future meeting.
All right, and I see no further requests for comment. Shall I close the Q&A panel?
Yeah, that would be great.
Okay.
I have to apologize for the barking dog in the background. So I really appreciate everyone's time. I'm going to go ahead and call for an adjournment, and I ask you to stay tuned for what we end up talking about next. Again, I think we're just getting started with this, and I think there's a lot more ground to cover. So I appreciate all of your input and your time today very, very much. Thank you. It's been very, very enlightening and helpful. And I appreciate it. Thank you very much.